Hey everybody, what an intense week this has been, and I hope you're all doing well out there and keeping your immune system strong and staying healthy. And now more than ever, it really feels important to do our practices and to take care of ourselves and each other. And today I'd like to share with you a few things about something that feels really relevant given the times, and that is utilizing telehealth, which is the virtual or online delivery of health services for yoga therapy. As you are probably already aware, telehealth is a growing method for increasing access to healthcare to different populations, and it's used for various medical and behavioral health disciplines. And in addition, you're probably very aware of this, and that is online yoga classes have been popular and prevalent for some time now. And I like to think about the viability of telehealth for yoga therapy as a marriage between telemedicine and online delivery of yoga classes. And so here are a few things that you might consider if you're interested in leveraging telehealth for yoga therapy. First of all, leveraging telehealth may enable you to serve people who may not be able to reach you otherwise, and those might be people who are in remote areas, or perhaps they're not well enough for whatever reason to see you in person in office. In addition, millennials might prefer the convenience of telehealth, while rural and other underserved populations may just really appreciate the increased access to what you have to offer. But make sure that the technology and what you're offering via telehealth really matches the audience you intend to reach. Utilizing telehealth might also be more cost-effective for you as the provider. You may not need to access a physical space to see clients. You might be able to do this from your own home as well. I think that telehealth can also help with the compliance of the client's treatment plans. That's what we're asking clients to do, right? In between session are their treatment plans. And now that they're familiar already with technology, they may be more disposed to using perhaps a recording of your session or a practice or a meditation that you did together in the days between or weeks between sessions. On the flip side, there could be some challenges with telehealth, of course, like getting yourself set up with technology, particularly if this is a really new area for you. In addition, the yoga therapist might also really need to rely more heavily on the client's intake or total health assessment that's written and provided ahead of time versus the in-person assessment that you do in a live session together in the same room. The yoga therapist may also need to ask the client to self-report more things, take photos of themselves and their posture or in poses that can really enhance how the yoga therapist sees the client. And last but not least, it's really important to remember that telehealth sessions need to be kept to the same level of professionalism as in-person sessions. So that means keeping client info safe and confidential, and treating the client contract that includes how to handle virtual sessions. What happens if the technology goes down, for example. So I hope you enjoyed today's video. Also, a little heads up, you might want to tune into our podcast this week. Should be coming out in the next day or two. I interviewed Ann Swanson, who is the author of Science of Yoga, and also does her yoga therapy. She's a yoga therapist, and she does her practice 100% virtually utilizing telehealth. And she shared in that podcast interview some of the ways she has successfully navigated some of the challenges that come from delivering yoga therapy via telehealth. Take care, everyone. Be well. Talk soon.